So we've seen how weather forecasters use ensemble forecasts. They take all the things they don't know, the extrapolation to all the areas they don't have data for, and of course there's an uncertainty what's going on in some place where you don't measure it, and you start your model with different guesses at what that value might be. And exactly the same thing is done for pandemic modelling. So let's imagine a pandemic like COVID is raging and you've got one of these agent-based models where you simulate a large number of people. Now what you might know is, let's say you've got all these people and you've tested these people, 6 people, because of course it's only ever a small fraction of the population you've tested. And of these 6 people, 5 are fine and 1 had COVID. So that's your data. So you can run forward and say, okay, who's that person infected? But of course, there are almost certainly more people who've not been tested. It could be that this person who tested negative is actually positive, it's just not showing yet. This could be a false positive. And there are almost certainly other people who have not tested, maybe who are asymptomatic, who have the disease. So your model has to assume this, so you have to randomly put in some more people to account for the fact that most of the time you've tested no more than half the people with the disease. Now it could be that maybe it's this person you put in or this person you put in who've got undiagnosed COVID, but this person's a very sociable person, whereas this person's a bit of a loner. So if this person gets it, it's going to be much worse than if this person gets it. But maybe there are no other people that have got it. So this is what we mean by the uncertainty in the inputs. So you put in all the data you've got, which is how many people have been tested and whether they tested positive or negative. You also have to put in what you know about the disease, like how infectious it is, what the incubation period is, and so on. But none of these numbers are certain. And so what you can now do is run your simulation with a bunch of assumptions. So you might think there are between 5 and 50 undiagnosed people with COVID in Victoria, and these people might be old or young, they might be in a sociable or not sociable. So what's going to happen if you release lockdown, for example? And this is indeed the simulations that were made by James McCaw for the Australian government towards the end of the Victorian lockdown. So Victoria had a few cases, this grew into a massive wave, they came to a very strict lockdown and the number of cases dropped off and was coming very close to zero. And everyone was thinking, we've been locked down for so long, schools are being closed, work has been closed, I want out! But is it safe? You're getting very few people showing up with testing positive, but almost certainly there are some positive people out there you don't know about. And so this sort of ensemble modelling, you can randomly try hundreds of possibilities. So you know what fraction of people have big social networks and small social networks, what fraction are school-age kids, what fraction are elderly, and so on. And you can try over and over again to randomly assign some of these people to be positive with COVID, allowing for the probability people who are in an essential job and have to be out and about are more likely to catch COVID than those who've been locked down, and so on. And so you can factor in your model as best you can, and you can see that most projections were the numbers would continue to decline, but there was a small chance the numbers would take off again. In this case, the government decided that the cost of continuing the lockdown was so great they had to release the lockdown, and luckily the median model was best, and in fact the outbreak did go away. But here are 4 different models out of the many that went into predicting this range of uncertainties. And so you see red is the number of infections, so yellow is the number of cumulative number of infected people, and blue is the number of susceptible people. And what you can see here is a model where you had the wave, it came through, and then it got down nice and low, and then it died away. So presumably the few remaining cases of COVID here were in people who didn't pass it on, and so you're in luck. But here's a case where it almost but not entirely went away. There were clearly still a few cases. To begin with, it didn't spread because everyone had too much immunity, but then as people's immunity waned and new strands came along, it took off again. And so on and so forth. You can see there's a variety of different possibilities, including multiple waves, dying out, or coming back. And you don't know which of these things is going on. And the fact that all of these things are possibilities is important for the government. So here are the projections that were actually made on different dates. In the Victorian wave, the projections were that it might take off, but most likely wouldn't, but there was some chance that it did, and it did. That was by 24th of June. There were early indications there was a potential wave coming. By the 1st of July, they could very confidently predict things were going to be very bad. On the 8th of July, there were some anomalies in the data. The black line is the data they were working with at the time, and it seemed to suggest the numbers were dropping off. And everyone thought, oh, maybe it's gone away. But that actually was just a fluke. Maybe there were errors in the testing or something like that. And by a few days later, the numbers had jumped back up again, and it was clear there was going to be a major wave. And then they started putting in lockdown projections that showed that it would come down. And indeed it did. And by and large, the estimates worked pretty well after that. But you can see at any given point there was quite a bit of uncertainty about what was going to go on, and it was important for people like James McCaw to tell the government this. Sometimes you can make very confident predictions, and sometimes, especially when numbers are very low, just completely random events, whether it's 1 or 0 people, sociable people who have it, can make an immense difference. So this is how you do uncertainties here. Once again, it's ensemble modelling, and it's absolutely crucial for governments trying to make these hard decisions.